Alright, so we are going to move on to the humanistic, interpersonal, and group therapy approaches. So in here we are going to discuss the humanistic approach, illustrate interpersonal therapy, kind of explain what group therapy, family therapy, marriage therapy is all about, and the effectiveness of all these different types of psychotherapy. Okay, the humanistic approach is feel-good approach. It's talking about reaching your full potential in life. Okay, what can you do? And so when it's called a person-centered therapy. Okay, and what we want them to do is to reach one's potential, to reach what we call self-actualization, reaching your full potential in life, your goals, and all those other things. Okay, and so with a humanistic approach to therapy, we're talking about solving your own problems, emphasizing self-responsibility, and perhaps changing the way you interact and think among other group of people. And the most important thing, according to humanists, the most important aspect is what's called unconditional positive regard. Unconditional acceptance for who someone is. Okay, with all their flaws, with all the things that you like about them, there are things that you dislike. And the therapist will completely accept their client for who they are. They don't make any judgments about any past behaviors that they have done, whether or not they agree with them or not. That's not the point. The point is showing unconditional positive regard. To be able to listen, to when a client or a patient says something, to restate what they said in a different way, to show that you are listening, you are understanding, you are being empathetic. Okay. Interpersonal therapy talks about how you relate to other people, how you get along with other people. And if you're not getting along with people very well, then what kind of strategies can we implement in order for you to begin being able to make friends, be able to talk to other people, to be able to develop social skills, to be able to work through conflicts when conflicts happen, be able to role transition. Let's say you're mad at your boss. Try to imagine what it's like to be your boss, and would you have come to the same conclusion as your boss? Group therapy, like family therapy, a group of people come together and try to figure things out. Marriage therapy is part of that too. Okay. You try to focus on family dynamics. Maybe you have a teenager that is out of control. You go there and then you try to come up with strategies, both you and your teenager and the therapist, to best help the family dynamics and to improve the dynamics as much as possible. Self-help therapies, it's kind of like the 12-step program, Alcoholics Anonymous, things to help you get better by interacting with people who have shared similar experiences. If you have a bunch of people who are addicted to drugs, well, sharing your experiences with other people who are similar to you, you could discuss the things that you go through in life, the hardships that you all go through, and then you could talk about how each one of them had to overcome these hardships in order to stay sober. Psychotherapy is good, but it doesn't work for everybody. Nothing ever works for everybody. There's some things called spontaneous remission, where people, fall off the wagon, they start drinking, start doing drugs, start behaving like they did before. Okay, so treatment is kind of continuous. You can't just say I'm done and I'm no longer drinking ever again. You're gonna have to go back every now and then. You're gonna have to refresh. All right. There's no single form of therapy that seems to work best over any others. Again, human beings are different from one another. Some things works best for others, some works best for you. You know, you kind of have to try it out sometimes and see what really works for you. But with most psychotherapies, it has some basic things that are similar among all of them. All right, and that's having to deal with these negative emotions or negative thoughts that you're having, and to be able to change those thoughts. Biomedical treatment, again, now this is treating disorders medically. And we'll talk about drug therapy, we'll talk about electroconvulsive therapy, which is shock therapy, and other biomedical treatments. Okay, so drug therapy, let's say you're feeling depressed and you've been depressed for a while. You can actually go talk to your family physician or your physician, personal physician, and ask, you know what, doc, I've been really anxious for a long time, or you've been depressed for a long time, and they can prescribe you medications, usually SSRIs, which are selective serotonin reuptake inhibitors, to increase serotonin levels in your brain. Serotonin is a neurotransmitter related to mood and appetite. Okay. If you got some psychotic problems like delusions, hallucinations, well then you take medications to treat those as well. For example, like schizophrenia, you have way too much dopamine, so you can actually decrease the amount of dopamine levels in your brain by taking drugs that decrease the levels of dopamine in the brain. Okay. And so that's how the antipsychotic drugs work. Usually anxiety and depressions are SSRIs. Again, you have antidepressant, which again is usually SSRIs, but you can use antidepressant drugs for other disorders like anxiety disorders and bulimia and eating disorders. And you have the three different SSRIs are on the bottom. Then you have tricyclic drugs, which increase the neurotransmitter norepinephrine, and MAO inhibitors, okay, which is an enzyme, and breaking down the neurotransmitters. I don't know a whole lot about that one. I need to educate myself on that one. Mood stabilizers like lithium, for people with bipolar 1 disorder. Lithium is, like I said earlier, is on the periodic table as, I think, some kind of sodium. And it can be used. It's the same stuff you find in your phone battery, believe it or not. Lithium ions, lithium. Well, there's an edible version too of lithium, and that helps people with bipolar 1 disorder. And it is highly effective. It works very well. Usually the first thing that doctors will prescribe if someone is bipolar. And again, anti-anxiety medications, again, this treats the symptoms, right? But if you have these symptoms because of a psychological problem, or you're not getting along with people, or, you don't treat the reasons behind the symptoms as far as socially and personally. But you do treat the symptoms of feeling down and depressed and all those other things. Okay, electroconvulsive therapy. Again, this is shock therapy. It is highly effective for people with major depressive disorder. Where nothing else works, you go in there and it does help with major depressive disorder really well. It's not as bad as the movies make it look. They usually give the person a muscle relaxant, something to put in their mouth, and they shock. It's kind of like your computer. Sometimes your computer screws up, and the only thing that seems to work is to reboot the darn thing, and it runs better afterwards. It's kind of the same thing when it comes to ECT, shock therapy. You kind of reboot the computer up here to make it run better, and then it runs better. There's very few side effects. One of the side effects is sometimes some memory losses, but that's pretty much about it. There is nothing wrong with shock therapy, electroconvulsive therapy. It is perfectly fine, and it works great for people who use it. Transcranial magnetic stimulation. You have this big magnet, and they localize an area of the brain that they want to treat, and they turn on that magnet, and there's a clicking noise. They click, 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 and it's treating part of the brain by using, magnetic stimulation, and that seems to help too. So biomedical therapies are effective. They, again, if I had to choose, I would use an eclectic approach. Use medical treatment, use psychotherapy. Okay, use them all, and the combination, biopsychosocial way, the combination of all those put together will produce a more probable, healthy outcome. That does not mean that whatever issues that you're dealing with won't come back. They could. Or it doesn't mean that whatever treatment that you used didn't work. It might not work. But the idea here is to continue to search for things that do work for you, and to not be ashamed to go look for the help that you need. Especially, if you're depressed for a long time and it's not normal, or you're always anxious every single day, or you're hearing voices in your head. You got to go get help and not be ashamed of these kind of things. All right, that's it for this chapter.